COVID has killed more than 800,000 people in the UK, and the number of cases continues to rise across the nation. But coronavirus vaccines have started to be rolled out over the past month, and millions of people have taken the chance to get immunized against the deadly infection. Record levels of COVID cases have been reported in the UK over the past few weeks. Prime Minister Boris Johnson was forced to announce a third national lockdown at the start of the month, to curb the rising infections. Vaccines have already been launched, and their delivery is being ramped up. But can you still catch the coronavirus, even if you've had the vaccine? We will use your email address only for sending you newsletters. Please see our privacy notice for details of your data protection rights. The coronavirus vaccine is designed to significantly lower your risk of becoming infected with COVID-19. It cannot give you the infection, and it's been rigorously tested by scientists before being rolled out. There are two vaccines currently being distributed to patients: the Pfizer/BioNTech and the University of Oxford/AstraZeneca vaccines. The Pfizer jab is 95% effective, whereas the Oxford vaccine is up to 90% effective. That means if you have both doses of the Pfizer vaccination, and you come into contact with the coronavirus, you're 95% likely to avoid infection. But that does mean that there is a very small risk that you could still become infected, as more and more people take up the offer of vaccinations. However, it's hoped that immunity will build up in the public, and the chances of infection will go down even further. The best way to avoid infection, even after being vaccinated, is to follow the recommended guidelines until the pandemic is declared over. Public Health England's website said, the COVID-19 vaccine that you have had has been shown to reduce the chance of you suffering from COVID-19 disease. It may take a week or two for your body to build up some protection from the first dose of vaccine. Like all medicines, no vaccine is completely effective, so you should continue to take recommended precautions to avoid infection. Some people may still get COVID-19 despite having a vaccination, but this should be less severe. It's still not entirely clear if you can pass on the infection if you're vaccinated against COVID. Until more research is completed, it's best to protect yourself and your family or friends by practicing social distancing. Wear a face covering wherever possible, and wash your hands regularly. Lockdown 3 is expected to end in the middle of February, although it could last until the end of March if the number of cases doesn't fall.